A blood clot, medically called a thrombus, is a clump of blood platelets that the body forms after an injury, as a way to heal the wound. As explained by the American Society of Hematology, blood clotting, or coagulation, is an important process that prevents excessive bleeding when a blood vessel is injured. Platelets, a type of blood cell, and proteins in your plasma, the liquid part of the blood, work together to stop the bleeding by forming a clot over the injury. Typically, your body will naturally dissolve the blood clot after the injury has healed. Sometimes, however, clots form on the inside of vessels without an obvious injury or do not dissolve naturally. These situations can be dangerous and require accurate diagnosis and appropriate treatment. They actually lead to numerous serious conditions, such as stroke and heart attacks, which cause millions of deaths annually. Blood clots can be arterial and venous, both of which are dangerous, but the latter is deadlier as it can obstruct proper blood flow to the heart or brain. Arterial blood clots are characterized by muscle pain, weakness, tingling, and numbness in the legs and arms, as well as cold arms and legs. The main risk factors include obesity, high blood pressure, diabetes, physical inactivity, high cholesterol, and smoking. Venous blood clots develop slowly, usually after physical trauma. They develop in the legs and can be of three types: pulmonary embolism, which can be fatal, deep vein thrombosis, and superficial venous thrombosis. It is the easiest treat. If you have deep vein thrombosis, you may experience the following symptoms: swelling in legs or arms, pain or tenderness, increased warmth, cramps or aching, red or discolored skin. The symptoms for pulmonary embolism include shortness of breath, pain with deep breathing, rapid breathing, increased heart rate, a cough. In order to prevent additional complications, you need to learn to recognize the early signs of blood clots, such as tingling and numbness in the legs, cold or painful limbs to the touch, as well as a racing heart, nausea and vomiting, heaviness in the chest, excessive sweating, shortness of breath, and fever. Fortunately, you can avoid blood clots by making them thinner in a natural way. Eat a healthy diet. High cholesterol levels are among the main risk factors for blood clots, so a healthy diet, rich in fruits and vegetables, and low in sugar processed foods, and unhealthy fats will help you control them. Physical activity. To lower the risk of blood clots and high cholesterol levels, you need to be physically active at least 3 times a week. Stop smoking. You need to quit smoking since it is one of the most harmful habits you can take up. In this way, you will improve heart health, prevent blood clots, and boost overall health. Moreover, here is a list of the most powerful natural blood thinners. Garlic. Garlic, along with olive oil and onions, is a potent natural blood cleaner and antibiotic that prevents blood clots. Turmeric and ginger. These excellent blood thinners prevent blood platelets from clumping, thin the blood, and prevent blood clots. Vitamin C. Vitamin C is a powerful antioxidant that ensures your cardiovascular health, so you should increase the intake of citrus fruits, kale, cabbage, and fermented foods. Vitamin E. Foods high in this vitamin, such as kiwi, almonds, broccoli, green leafy veggies, avocados, and squash, keep your blood oxygenated and thinner. Omega-3 fatty acids. These foods include walnuts, fish, pumpkin seeds, and olive oil. Ginkgo biloba supplements. This powerful blood cleanser and thinner decreases the fibrin content in the blood and prevents the formation of blood clots.